Java with Joe, the podcast, is brought to you by Kemba Credit Union, celebrating over 90 years of quality service to our membership. Sponsored in part by First Choice Coffee, the official coffee of Java with Joe, and Real Vision.
Also by Bethesda Butler Tri-Health Hospital and Cincinnati State Workforce Development Center.
And now your host, President and Chief Executive Officer of the Westchester Liberty Chamber Alliance, Joe Hinson.
Thank you, Sarah. Today we're with Suzanne Burke, President and CEO of Council on Aging of Southwestern Ohio. Welcome, Suzanne.
Good morning. Thank you for having me.
Thank you. So are you from this area?
I am. Yes,
So where'd you grow up?
Grew up in Finneytown.
Finneytown, okay.
Right.
And so did you go to Finneytown High School?
I did. Yes,
okay.
I did.
And so I guess from there, then you got a bachelor's degree from Miami University.
Correct. Yes.
And went on to Xavier University where you got your MBA.
Correct.
So you were mentioning to me that when you initially graduated from college, you transitioned into a career that maybe some people don't really know this of you because you spent a lot of time in Hamilton County. But before that, tell us what you did.
Right. Okay. So I graduated from Miami, and I was a business major, but I took one sociology class and called up my parents, and I'm like, I'm going to be a social worker. And my parents were like, no, stay in the business school. Just pick up a minor. So I picked up a minor in gerontology, which of course is the study of aging. So I graduated and I promptly went into working in the field of marketing for retirement communities.
Okay.
So this was like, I'll give away my age here, but like the mid 1980s, and there was a lot of new growth in retirement communities. And I would describe it as like very chaotic, a lot of overbuilt, the numbers weren't there yet. So I started in marketing and I just really didn't enjoy it at that point in time. So I went from one retirement community to another, and then I decided I'm not sure this is the industry for me. So I left there and decided to take an entry-level financial position as a budget analyst for Hamilton County. And my goal was to stay there for 2 years and get some financial experience. And I left there 18 years later and came back to aging and really the field that I would prefer, which is home and community-based services and really helping older adults stay in their home.
Yes. And so you went to Miami, and then parents said, oh my gosh, you got a business degree, and what are you doing? But then you went to Xavier and got an MBA.
Right. So I did that while I was working for the county in the evening.
Okay.
Right? Mm-hmm.
Okay. So you spent 17 years at Hamilton County, and you had different positions there. Budget director.
I
right?
was budget director.
And you were acting administrator.
I was acting administrator.
And
when I
also
left.
you took on the job of director of job and family services while you were there.
Job and family services. That was always kind of my dream job. Again, I always kind of had an interest in social services. I was a foster parent when I was younger. So when I left the budget position, I actually went to domestic relations court and ran the child support enforcement agency, and then transitioned over to job and family services. And then somewhere in the mix, I got drafted to go over and transition what was then Riverfront Stadium.
Yes.
From the city ownership to the county ownership, and manage the team leases for the Bengals and the Reds.
Really? Very interesting.
Yes, and that was at the point in time that my former boss, the budget director, retired, and I stayed in as budget director for probably 5 to 6 years.
Really? So you have some insight in how those things work, of course.
Yes.
And a lot of that most recently has been between Hamilton County and the Cincinnati Bengals regarding their lease extension,
Yes.
correct?
Right, so I was involved in the original lease, issued all the debt while I was the budget director for the Riverfront Paul Brown Stadium.
Really?
Yeah,
Interesting.
very exciting times and a lot of growth on the riverfront.
Absolutely.
Very good time to be in the county.
Yes.
A lot of exciting things going on at the time.
So you transitioned, and I guess in 2005, that you are now in your current role, obviously,
Right.
as President and CEO on the Council of Aging of Southwestern Ohio. Tell us about that transition. 17 years at Hamilton County, did a lot of different things.
Yes.
But Council on Aging, Butler County, obviously is a focus. Southwestern Ohio, obviously more counties than just Butler. But Tell us how you transitioned to that role.
Yeah, so I was kind of at that point being drafted into being the acting county administrator. And I really, again, wanted to stay in the field of working with people and serving older adults in particular. So the opening at COA came up, and I thought this is a prime opportunity for me because one, just having the financial background that I did of handling all of the like local government funds, and then in the budget director role, I managed the tax levies for Hamilton County. And then JFS, of course, we had adult protective services for older adults. And so this kind of spoke to me because really I've always wanted to work with aging and really helping people stay at home, which is the mission of Council on Aging.
Sure.
And I think that stems from, I like to tell this story when I was younger, like 5, 6 years old. There weren't any children in our neighborhood. So my best friends were probably an elderly couple who were in their 70s.
Oh,
And every day I'd go over to their house and play with them all day. And so they would say, "What are you going to do when you grow up?" And I'd say, "I'm going to run a nursing home so I can take care of you."
oh,
And they would get a big kick out of that at the time because I was 5 and they were in their 70s. But, I've always enjoyed older adults. And so, but really, it's important to me that older adults have a choice of where they can live.
sure.
And that is really kind of the mission of Council on Aging, is trying to make sure people can be as independent for as long as they can and stay in the home of their choice,
Yeah.
and until they choose not to. And not that I'm not a believer of nursing homes. I am. I believe that there's a place in the continuum for all options, but people shouldn't be forced to nursing home as a default option simply because they don't have the resources or the care that they need, help that they need to be able to stay at home.
So as I listen to you talk and think about kind of what you started with as a 5-year-old and kind of your mission and what you want to do in the future, this has been kind of a passion of yours,
Yes. Mhm.
if I'm getting this correct from what
Right.
you're saying.
Right.
How exciting it is for you to be able to live out that passion and now be in a position to help others.
It is. And it's been like so exciting because when I came to COA in 2005, as an example, there was a waiting list. If you wanted to stay at home to receive care, the waiting list was thousands of people if you were on Medicaid,
Oh,
which people who are nursing home level of care, they can't wait on a waiting list.
right.
So the default for them was they had to go straight into a nursing home, which was not where they wanted to be, and B, from like a cost standpoint, cost to taxpayer, like 3 times more than if they would be able to stay at home.
Sure. Very good. So we're talking around this. So tell us what the Council of Aging of Southwestern Ohio does.
Okay, so well, we're really a resource. Let's start there for older adults, caregivers, family members, and the community at large. If you're needing something to assist you with the aging process, we offer a kind of one-stop call center with non-biased information, where you can call and get information and resources, and we can help direct you to whatever area you're needing assistance at. So there's that aspect. Secondly, and probably what we are known for, is we do care management and oversee the care of about 27,000 older adults
Oh,
in our region. So we cover 5 counties,
yes.
Butler included. We go as far as north as Clinton, and then south as Hamilton. And so really we have a team of probably over 400 staff who are community-based workers who are going in and out of homes every day, assessing the needs of older adults, and then what we call putting a care plan around them, identifying what services do they need to stay in their home. And then we have a contracted network of probably 600, 700 providers that we vet to go into the homes to actually deliver the services. Those could be meals. It could be wearing your life alert button in case you fall, transportation, assistance with bathing, grooming, anything an older adult or their family may need to help someone stay at home.
Very good. Well, I'm listening to you talk about this, and we've talked about, as you've mentioned, older adults here. You also work with, obviously, people with disabilities.
We do.
and also their families and caregivers. So
Yes.
this is not just the one side of someone who needs support. Caregivers and family need support too.
Tremendous amount of support, right? Especially the working caregiver.
Yes.
Because the working caregiver, I want to say right before the pandemic, we did a kind of a business survey that we had sent out to local employers to have their employees complete. And, we did the first survey. It was with a large kind of construction company that skewed more male in employees. And their CEO was surprised to see that over 45% of the staff already identified themselves as a caregiver and was already impacted at work by providing caregiving, right? So there's
Sure.
not a day goes by, honestly, that I don't get a call. I have a 96-year-old mother. All of
Wow.
my colleagues have older adult parents or friends that need assistance.
Sure.
And so we're there to support caregivers. It allows the services that we provide, frankly, allow individuals to be able to go to work and
Very
try to
nice.
stay focused on work if they
Yes.
know that a meal is showing up
Sure.
and their loved ones getting their meal during the day. They can't often go do all of that. And,
Mhm.
particularly if they're raising their own children, they're trying to do it all work,
Absolutely.
children, parents.
Oh,
It's
yes.
a lot.
Absolutely. Well, you mentioned the area that you cover, so I want to make sure that our viewers know. Again, you mentioned Butler County, Claremont County, Clinton County,
Uh huh.
and also Hamilton and Warren counties.
Yes.
And so this is, I think, Region 1, is that correct?
It is, yes. We're called an area agency on aging.
Okay.
We refer to ourselves as the AAA, not the car, but the area agency on aging for
Yeah.
our region. And we are a national infrastructure. So
Uh-huh.
even if you have a parent in Florida, there is an area agency on aging in a county in Florida that you could call for assistance.
Yeah, absolutely. Can you give us a little more detail on some of the range of services that you can provide? I know you mentioned before about, obviously we've talked about older adults, but allowing the caregivers to be able to continue to work, concentrate on work. We've talked about individuals with disabilities.
Right.
You get into basically the foundation of really supporting individuals in a broad brush way. Can you give us some examples specifically of what that looks like?
Sure. So I think typically, like what happens is you would get an assessment depending upon the program that you might be enrolled in as an older adult. We're going to come out, and if you're enrolled on a local program, for example, we're going to work with the family and identify like what can the family do and what can the family not do, and then we're going to fill the gaps. But those gaps could be anything from maybe it's a son taking care of his mother and he's comfortable with grocery shopping or getting her to the doctor. But when it comes to, do I want to give my mom a bath? No, that's where we might fill a gap. Have home care aides and assistants who do things like help with bathing, grooming, of course, meal preparation, laundry service, light housekeeping. We do assessments in terms of the home, like individuals may need grab bars installed to be able to help them up off the commode or safely shower. We will do those types of installations, ramps, minor home modifications to enable people to
Wow.
stay at home. And then we supplement them with the services. And it's not, what's important that we do is we also have a care manager that's assigned to the individual and the family. And that's because people's needs change. Older adults today,
Absolutely.
right? What they may need today, tomorrow, maybe
Yes.
not. And so they're always getting kind of visited and assessed. Do we need to tweak something in
Sure.
order for them to stay at home safely? So it can be anything really. And maybe, it could be simple things like they're not simple to the individuals involved. But if
No.
you're taking care of someone with dementia and they live with you and you may need to go out of town and need some respite,
Okay.
we can arrange for respite.
Very nice.
Yeah. So it's pretty broad
Yes.
and it's not a cookie cutter type of approach. It's very individualized. Like, what do you specifically need and what does your family need assistance with? That's what we try to deliver on.
Well, for someone who still has their mind and sees that, gosh, it looks like my option is to go to a nursing facility, but there's an option to be able to stay home. I mean, leaving the home is such a life-changing situation, that not only for the person who has to leave the home, but the family.
Right.
And to be able to have options to be able to keep them at their home and have assistance, I mean, that's a game changer.
It is. Right. And that's what used to not be in place 20 years ago, especially if you were on a state-assisted Medicaid program. And it wasn't for the right reasons, I'm going to say.
Okay.
I think at the time, back in 2005, one of the most powerful lobbies was the nursing home lobby in the state of Ohio. Consequently, all the funding went to that line item. And so part of our role as an area agency on aging isn't just to do the things I described, but it's to do advocacy and to promote options and choice for older adults. And, I've been, like I mentioned, in social services fields, but including when I was Job and Family Services Director. And it's just the way it is, but the communities tend to focus on children. Most of the organizations fund children's organizations, and older adults kind of get lost.
Yeah.
And they're not always the best to advocate for themselves, right? Many are homebound. They're not out where they can advocate.
Right.
And, at least with the cohort of older adults we've had in the not too recent past, they've been individuals who they'll tell you everything's okay.
Yes,
right?
yes.
They will.
Yes.
If you call up and you say, how you doing? Everything's fine. You go to their house, you open the refrigerator and see there's nothing in there, and everything's not fine.
Yes.
And that's why with older adults, a home visit is so important.
Yes.
Older adults will just tell you, yes, things are fine.
Yes.
Everything's okay. I'm doing great. When in fact, you can get there and see otherwise. And so that's what's also very important. I think that's, we always get, we talk about this, a rise in calls around the holidays, right? Because out-of-state children come in.
Oh, yeah. Okay.
And they're visiting, and then they see what's going on. And then they make calls.
Yes.
Because, again, if you pick up the phone, everything might sound okay, but it may not be okay.
Good points. Good points. You mentioned, obviously, to come in and visit someone, that's where you would talk about the assessment.
Correct.
That's correct.
Yes. Right. And that's where our staff, and we've got a tremendous mission-driven staff, would kind of assess the home. Like what does the home need in order for someone to stay in successfully and safely, and then they'll look to, what kind of resources we can accommodate.
Absolutely. You are considered one of the most active when it comes to advocating for Ohio's aging network in southwestern Ohio. Talk a little bit about that and what you've been able to do to really support what you do for a living here, and support, obviously, of older adults.
Yeah, so I thank you for that. I try to. I'm a kind of an activist personality at heart. But again, it really goes back to older adults needing an advocate, and really trying to promote their needs and champion their needs in a very crowded environment. Again, which often, they're not getting the resources they need. They're not where they can be to advocate. So we do it on their behalf. And as I mentioned, I think some of the work we're proudest about is really getting the funding stream moved from institutional to home and community based, where everyone can have an option to stay at home then if they choose. They may elect not to, right?
Right.
But at least they have the choice, and having the choice is really important. Because 90% of older adults, if you ask them, where do you want to be? They will tell you they want to be at home.
Sure.
At home where their memories are, where they raised their children. They were married, decades in the community, and they shouldn't be forced out of the community.
No, absolutely not. You're also past president of the Ohio Association of Area Agencies on Aging.
Right.
So not only do you believe it, you're a leader out there and helping others in Ohio. So talk a little bit about taking that next step and saying, this is something I believe in, and advocating that as a leader for, obviously, the aging population.
So again, there are 12 area agencies throughout the state of Ohio. And one of the things that, this is kind of unique. Most social service organizations, whether it's mental health or children's services, their funding comes through the 88 county structure. Aging is different. The older adult funding comes through the 12 area agencies on aging.
Okay.
So when I compare that back to when I ran Job and Family Services, you might have 5 large counties that had the bulk of the caseload. Your Cuyahoga, your Hamilton, your Columbus, Franklin. And then you'd have, 82 other smaller but you couldn't get any advocacy movement because no one could agree on anything. Whereas in the aging network, there are 12 of us. Most of us have a mix of rural and urban, and we are very cohesive, and we have the same goals. So from a statewide advocacy perspective, we can make a pretty significant, strong presence.
Absolutely. I've heard you mention, obviously, your role with Job and Family Services in Hamilton County a couple times as we've been talking. So that role that you had in Hamilton County has really helped you in your progression of what you do today.
Yeah, I think so. It's a totally different environment. But certainly understanding too kind of just the simple differences between being one of 88 versus one of 12, and how we can mobilize our advocacy being one of being 12, and really trying to just shine the light on aging across the community is very important. The community is growing older. Ohio is one of the largest states of aging populations, and so that has implications, as you as a chamber organization and all of your members, not only probably are your members finding there are more older adults staying in the workforce, either by desire or necessity. You also have, again, all the caregivers in there who have parents who are in their late 80s, 90s, who, when the call comes, hey, mom's fallen, they're up and leaving, right? Or hospitalizations. And, if there's one thing I could change, and it's, I think it's human nature, is nobody plans for aging, right? A very few. And I think what people don't realize, it's, people think Medicare pays for long-term care services, right? And when do they discover that it doesn't?
When they need them.
When somebody goes into the hospital, comes out, has no place to go, right? Maybe has some short-term Medicare coverage, but then they're on their own.
Yes.
And most individuals are what we like to call one financial crisis or one healthcare crisis away from being eligible for Medicaid. And, that program, you have to be basically destitute, spend down all of your funds. And so if you're in that other category, which is the majority of older adults and their family members, there's nothing.
Correct. Yes.
And that realization doesn't come until they're trying to figure out a plan for all of a sudden my mom's being discharged tomorrow. It's always that from the hospital. People are calling like, in the hospital, and they have to come out in 2 days. Now what?
Yes.
And so, years ago, I think people, even a very small portion, got long-term care insurance. They didn't do it because it was too expensive. Now it's very expensive.
Yes, it is. And it
if even offered,
increase.
right?
Yes, I'm with you.
And so the majority of people do not have the resources they need to handle their long-term care. And that's what is so important for us to have people understand. Plan early if you can, right?
Yes.
But also don't wait until the last minute to try to understand what the network might look like.
Absolutely. So for the work you've done in 2021, you received the Cincinnati Business Courier's C-Suite Award for a large nonprofit organization. And you also were recognized for your organization's COVID-19 pandemic response efforts. So talk a little bit about that. Obviously, I think the award was wonderful for yourself and for your organization, but people have recognized what you guys are doing and you're making a statement out there. And I surely think people were paying attention. How rewarding was that to be recognized by the Business Courier and then also recognized for what you were able to do during COVID?
Well, it's very rewarding, but I will say it's a reflection of all of the staff at
Sure.
COA because we're an organization who are all pulling together for the same mission to help older adults. So, but very appreciative of that award. In COVID, that was a very challenging time, especially for our staff and the individuals that we serve. And if you think about that population during COVID, like the highest risk group was the older adult group. I think one of the first things that we recognized was we're going to have to transition from home-based to telephonic because of the risk of, COVID, and really trying to make sure our team could transition as easily as possible to reaching out to older adults and making sure the services continued if they wanted them to.
Yeah, sure.
Because again, that's another challenge. Nobody wanted anyone walking into their home. So really, we rallied around at the time trying to make sure older adults got vaccines,
Yes.
which was challenging. Getting them scheduled,
Mhm.
hosting vaccine clinics. We were, I think, one of the first AAAs in the state of Ohio to get like a vaccine clinic going.
Very nice.
So really just used, our staff all, again, it's really mission-driven group. So it's what do we need to do in the current time to help the older adults that we're serving. And that's
Absolutely.
pretty much what we did.
Yes, and as we like to say, there was no playbook for this.
Right,
We were all in different industries across the world. We're having to deal with this,
right.
and so post-COVID, if you will, how is an aging society impacting Butler County and our business community today?
So one thing I will say just in post-COVID in general, we do like every several years kind of a community needs assessment. And post-COVID, and for as long as I've been here, 20 years in July, your top items are always your top items. More in-home care, housing, transportation. Post-COVID, we started seeing things like a need for social isolation programs, behavioral health coming from the
good
group.
point.
That had never been on a kind of a community needs assessment before.
Good point.
And that is because I think when people were cut off, older adults get from their families and things, more depression.
Yeah.
So post-COVID now, we're kind of back. We've struggled with workforce issues. Being a home care aide is a tough job.
Yes.
And what we've tried to do, one of our organizational values is innovation. What we've tried to do is identify ways to bring new people to this industry. We created an app that allows people to do gig work and be able, maybe if they're a nursing student, they can pick up caring for an older adult in their neighborhood. So we're really excited about that because it's enabled us to bring non-traditional aids to an industry that desperately needs aids.
Very good. Yeah, absolutely. So let's talk about the challenges today and that you're facing as an organization that serves older adults and their caregivers. Those challenges, I'm sure, just continue to magnify, and you've talked about some new things that have obviously entered the picture.
Right.
So the challenges, I'm sure, just continue to increase as the world continues to change and the population continues to age.
Well, that's it right there. The demand is far outgrowing the resources. And so in many of our programs, we've had what we call managed enrollment, like a queue, one on, one off kind of thing. You can't come on. Or we've had to tighten eligibility such that the frailest of the frail are the individuals qualifying. So that's a challenge because the older adult population continues to grow. Resources are not growing with them. So we're always trying to look at ways to, be more efficient. So we have a motto, which is to provide the highest quality services at the lowest possible cost to serve as many individuals as possible with the tax dollar. So that's our motto, and that's what we're always looking to do. I mentioned that we have a contracted network of like 670 providers. So an example of that, your life alert kind of pendants, we will bid one contract region wide so that we can get significant economies of scale on the device. And we have saved, all of the counties, millions of dollars over that type of approach.
Very good.
Even when you compare it to the state Medicaid rate, we pay probably 60% less because we use the market. We competitively bid and we get the benefit of the market and the economies of scale. So we're always looking at opportunities like that. That's kind of like where I kind of come in. Like one of our organizational values is also business acumen.
Well, and I was going to mention that. I'll
Yeah.
go back to your MBA.
Yeah.
And, obviously studying business early on. I mean, that obviously is to your benefit also.
Right. Because we are a business, right?
That's right.
People say, well, no, you're a nonprofit. No, we are a business.
Right.
We are here to make sure that we are spending, whatever resources are entrusted to us as efficiently as possible.
Sure.
Because it is very hard for our staff to tell people we can't help them, right? So the more
Absolutely.
that we can do to make sure we're delivering things efficiently and we can get some that allows more individuals to be served. So that's our charge. Our staff get, even the front door staff when they're calling and people are seeking assistance.
Mm-hmm.
If every community resource is tapped, which often they are, you're not really in the job you want to be in when you're trying to help people when you're telling them, I can't help you.
Sure, absolutely.
So it's really important to us to not only, operate with a business mindset, but also to be innovative and really try to improve services.
Sure.
And the quality of services individuals are getting is really important.
Absolutely.
And years ago, like when I first came, kind of meals went like this. Whatever was coming off of the one meal assembly line is what you got, right? If you didn't like Salisbury steak and beets, too bad. That's what you were getting.
Okay.
Well, over the years, we've encouraged choice. And we have some, through the competitive process with bidders, like choice. If you're going to produce one meal, we're going with someone who's going to offer older adults 5 choices.
Very good.
Allow them to pick off a menu. That's what people want.
Sure.
Right. So that's what we're focused on. And that's why this job is never boring, because there's so many opportunities to like, what can we do next? Like, what can we improve? How are we going to serve people better? And that's where we are. Well,
with the can-do attitude, you make a difference. So people watching us today, how do they connect with you? How would they, they have a loved one, they themselves are frustrated because they're a caretaker. They want to be proactive instead of not being reactive to the point you brought up earlier. How do they connect with you?
So they can call our front door, which is 513-721-1025. They can connect through our website, which is Help for Seniors, with the number 4. So really just giving us a call, sharing with the staff that are answering kind of what you're seeking. Our staff, again, they know the internal program resources and they also know all of the external resources in the community. And it could be even somebody calling for legal help, right? We're going to be able to refer them to pro seniors or, somebody who might be able to assist with legal assistance.
Very good. So what can we expect from the Council on Aging of Southwestern Ohio here in the future?
So hopefully more innovation. In Butler County, we do have a levy that will be on the ballot this fall. We are asking for an increase. It's been 20 years since there was an increase in Butler County. And that's really, again, to help us meet the demand of older adults seeking assistance. So that you can expect in the very near future. But I think other than that, we're really continuing to try to find the best way for older adults to stay in the community, age in place, and get the highest quality services they can get and be able to be a part of their community. That's really important to us. And to be around their pets, their family members, their neighbors, to live their best life and as they age.
So you mentioned obviously the interest in workforce.
Workforce.
Yes. People that might be interested that maybe they have a job. Are you looking for volunteers also?
So
'Cause-
generally for our organization, we don't do a lot of volunteers just because of the nature of the continuity of going into the homes and having one background checked and everything. A lot of our providers still do volunteers, like Meals on Wheels
Okay.
providers. Also, they use volunteer meals providers. But from a staffing standpoint, we are always looking for individuals who have an interest in working with older adults,
Okay.
especially people who like to go into the home.
Yeah.
We do look in particular for social workers, licensed social workers, but we also, in the care management arena, hire individuals with just college degrees, with experience, especially if they have some working with older adults or really just have an interest in it, right? That's what's really important. You know how that, if you're not interested in what you're doing, you tend not to be the greatest at your job.
Yeah. Well, we brought up passion a couple times, and
Yeah.
obviously that passion for obviously what you do and what others do in your industry. So we're just so happy to have you here today. This has been Suzanne Burke. She's President and CEO, Council on Aging of Southwestern Ohio. Thank you for being with us,
Thank you.
Suzanne.
I'm so happy to be here. Thank you so much for inviting me and for the great work the Chamber does. We've come to your expo. We appreciate that you allow nonprofits to join and be a part of the community with you.
Okay. Thank you.
Java with Joe has been brought to you by Kemba Credit Union, sponsored in part by First Choice Coffee and Real Vision.
Also by Bethesda Butler Tri-Health Hospital and Cincinnati State Workforce Development Center.
Thanks for listening.